last, I would like to celebrate everyone in the room. This room is filled with healthcare workers and providers who work tirelessly to provide cutting-edge, evidence-based behavioral health care to our patients. For acknowledgements and awards, I would like to turn the floor over to Mark Woods, who is the Assistant Chief Nurse Executive at UK Healthcare Behavioral Health, and Dr. Andrew T. Cooley, the Chief Medical Officer at Eastern State Hospital. Please welcome them.
All right, thanks, Cassie. Andy, I'll see you in about 10. I realize we're kind of standing in between you and lunch, so we'll try to be as efficient as we can be. Who knew last year when our research council decided that they were ready to put on the first Research and Practice Initiatives Day, that we would have overflowing chairs and crowded rooms wanting to hear what we had to say? Well, we did. We knew we had some really good things happening, and we wanted to be able to share those things with people. If someone had wondered whether or not Eastern State Hospital was serious about research and evidence-based care, they wondered no more. We're very committed to putting our patients first, and we're very serious about living our direct values: diversity, innovation, respect, compassion, and teamwork. So today, at only our second rapid conference, all of those values are visible. It is the innovative planning by a diverse and multidisciplinary team working together to create an agenda that respects both the patient and provider so much that this year's theme and one of our values is compassion. We're all at our best when we live our direct values, so thank you to the Research Council for their work and for pulling together a really good agenda for us today to be able to celebrate those accomplishments. I also want to thank the excellent leadership of the following people. I know that a lot of you are live streaming, so some of you may or may not be in the room. Do kind of maybe stand for a second so that we have the opportunity to kind of thank you personally. As executive sponsors for this group, Dr. Cooley and I would like to start by thanking UK Healthcare, particularly Dr. Colleen Swartz, Vice President for Clinical Operations, Dr. Seth Himmelhoek, Chair of Psychiatry. We'll do a hand raise maybe. That's right. And Dr. Gwen Moreland, Interim Chief Nurse Executive. I believe she may have had to step out for a second. From the College of Nursing at UK, we would like to thank our dear friend, Dean Janie Heath, for her forever support for all things behavioral health. So we appreciate her for that. And Dr. Zimma Coley, the Associate Professor and Director of Tobacco Treatment and Evidence-Based Practice at Eastern State Hospital through a partnership with our College of Nursing and UK Healthcare. Very integral piece in helping us put together our research council at Eastern State Hospital, so thank you, Zim. We'd also like to thank Eastern State Hospital's administration, especially Carrie Rudzik, our chief administrative officer, for her inspiration and support of all the things that we've done and accomplished, and certainly Eastern State Hospital's Chief Medical Officer, Dr. Andrew Cooley, as well, to help with all of the support. Lots of claps going out to everybody. We appreciate it. We would also like to recognize some special guests, Dr. David Sussman, who was a speaker at last year's, one of the inaugural rapid presentations that we have in the back. And certainly our beloved guests from NAMI Lexington, who's always in support of anything behavioral health, certainly at Eastern State Hospital. So, our research council consists of a very diverse group of individuals from different disciplines. I'd like to kind of recognize them for those that are in the room. Do pay particular attention of just how diverse this group is. From psychology, we have Lindsay Jasinski, Sean Riley, and Chaplain Mike Sibley. From pharmacy, we have Elizabeth Boltenberger. From social work, we have Adam Davis, Cassie Brown, and Lela Still. And from nursing, we have Crystal Harold, Diana Spring, John Willoughby, and certainly Zim Coley. If you guys are here, stand up for a second. Let us appreciate you. Yep. Yes. This next piece was not on my list, but I do feel like we need to show appreciation for these two very special individuals. We'd be remiss if we didn't recognize the amazing work that Heather Robertson and Cassie Brown has put into today's event. You guys cannot imagine what goes into the planning and execution for one of these events, and these guys are absolute rock stars. And if you know anything about me, that is the highest level of achievement in my rating scale, rock stars. So if you guys would stand up, Heather and Kathy. And finally, we'd like to thank our presenters for today, Mayor Gorton, Dr. Alan Brenzel, and Adam Lesser, for your time and interest in a population who, when many others turn away, you move toward. When others say there is no hope, you shine light on the hope that was always present. And when you are busy with standard of care, you choose and you seek out to incorporate and include additional research and evidence-based practice so that our patients can live their very best lives. Thank you for that. My sincere thank you for that. And for most of all, for sharing your expertise with us today. So, all right. So now it's time to celebrate you. So Dr. Cool, if you'd come up and announce our awards.
Well, I am honored to return. This is the second time I've been in this position to hand out the goods. And because this is a research day, I did research, Cassie, and I found out that Billy Crystal got to return 8 times for the Academy Awards. So I've got 6 more times that I want to come back for this, all right? But all levity aside, this is a great opportunity to identify people that are very deserving. I get to present 2 awards. The first is external, and the second is internal. Both are equally important. The second one is going to take me a little bit more time because there's more opportunities. But the first and our external award is an inaugural award. We have not presented this in the past, but we are now. This award goes for someone, a group, that has really transformed the ecosystem of mental health as far as prevention. This year's award goes to a group that has done seminal research, that has done a transformative approach to preventing suicide. Their work has been cited, it has been accepted and promoted by the Department of Defense, CDC, FDA, SAMHSA, the World Health Organization, and I'm proud to say, now UK Healthcare. Our first award for the Rapid Visionary of Behavioral Health Award goes to the Columbia Lighthouse Project for this Promethean and accomplished task. So what I would like to do, Adam Lesser, is invite you back up here so you can receive a small token of UK Healthcare's acknowledgement of your group.
Thank you so much. I
Thank you.
appreciate that.
Thank you.
It's very nice of you. Very kind.
Thank you. All right, Mark's reminded me that I'm impinging upon dinner time or lunchtime. So this is going to take just a little bit, but I want to acknowledge the 10 different groups that have participated today. I want to say that I'm humbled at the work that you've all done. Some of it has been in the form of questions. Some of you have published papers, but it's all adding to what we call our science base. And I think a challenge for the next group is that I don't get the opportunity to do this again. Now, Cassie, I want to come back and do this, but I want to have so many papers next time, so many posters, that we don't have the opportunity for me to identify the 10. Next year, there could be 15 or 20 or 30. And the other thing that I want to challenge this group, here's a poster for someone. I'm going to give this to you. See how many of these different 10 posters or papers are actually cited in the literature. I think you're going to be surprised. I'm not going to be surprised, but I think you're going to have a poster out of that because these 10 are all contributing to what we need to take care of our patients. So what I'd like to do is have the group stand up and be recognized. The first group took on a task that a lot of people don't like to talk about: sexual aggression and sexual violence. They said, what is the treatment for a very disturbing behavior in an individual who had IDD or autism spectrum disorder? That group, Katie Beth Sharp, please stand up. Lindsay Jasinski. Clark Lester would be here. He's on maternity leave. Our entire Greg One staff. Brian Brown. I don't know if Brian's here. Brian's one of our MHAs who's just a giant, as Mark would say, a rock star. Thank you for looking at something that people don't like to look at. Our second group said, what if? What if something we think is effective, we can prove is effective as far as improving cognition, mental health, and physical health? What if it comes in the form of cardio drumming? That group, Jessica Herwig, Allison Jones, if you're here, please stand up. We've heard from Dr. Brenzel about the just pernicious epidemic of the opioid crisis. And the next group said, mat therapy. Okay, but maybe mat therapy is not enough. And we know that that's correct. It's not enough. So this next group said, what if we cobbled together pieces of evidence-based practices and we examine them prospectively to see if they treat substance use disorders of an opioid type? That group, their SMART program, Lindsay Jasinski, Elizabeth Riley, numerous different other members, I think, of the Department of Psychiatry who may not be here today. Please stand up and be recognized. Is Elizabeth here? Sometimes things in medicine look like they make sense. And then if we hang a question mark on them, we find out that they don't make sense. It might sound intuitive that by providing more care, it might seem intuitive that if you had a longer length of stay, you might have less mortality or less morbidity. But one of our groups said, let's look at prima facie logic and let's look at outcomes. That group looked at the average length of stay, the risk of readmissions, complications, and mortality at the hospital level in psychiatric patients. That group, our chief, Samantha Zwabel, Justin Strickland, please stand up. All right. Sigmund Freud made a lot of contributions to mental health post-World War II. But one of the things we know now is that we treat a lot of disorders that are brain disease and brain disorders. The evidence is clear. And we have to reinforce that sometimes because there's a reflex sometimes to dismiss that. We know that schizophrenia affects many parts of the brain, and we know that it affects cognition. And we had a group that said, we're going to hammer one more nail into the coffin to dispel this mythology that these are not some sort of psychological disorders. These are brain disorders. They affect cognition. So for the group that decided to put one more nail in that coffin, as far as neurocognition profiles of individuals with schizophrenia spectrum disorders in an inpatient psychiatric setting, Elizabeth Wallace, Dr. Lindsay Jasinski, please stand up and be recognized. Our next group said, what if a performance improvement project can lead to improved clinical care? Good. What if eventually we can re-examine that and see if a performance improvement project can also improve morale and employee satisfaction? That group, Lella Still, Carly Dickinson, Mary Beth West, Stephanie Clark, thanks for looking at that. Stand up and be recognized. For this next group, I hope my accent will not interfere with the actual announcement. But this next group said, what if we can effect patient care by changing the affect of our staff? Michelle Van Outer, Teresa Luckett, Lauren Blunt, please stand up. All right. For those of us who remember, we had a previous president, Dr. Lee Todd, who once said, if you can't count it, it doesn't count. I believe 90% of that. But I subscribe to his thoughts and his conviction for outcomes. We all had a group at Eastern State who said, let's look at outcomes. Let's look at things that we do on a daily basis. That group said, let's look at outcome measures for a recovery mall program and see what we get. That group included Francis Howard, Lindsay Jasinski, Sean Riley, Amy Osborne, Andrew Lane, Jesse Wilson, and Cassie Brown. Please stand up. All right. The next group took on a Herculean task that affects many Kentuckians. And they said, let's look at 3 different issues that affect tobacco use disorders, whether it's nicotine replacement therapy, or whether it might be something like the use of pamphlets in an inpatient setting. And let's look at the literature as far as a quit program. That group included Yarzan Al-Marat, Madeline Strong, Caitlin French, and Zim O'Cauley. Please stand up. All right. I've left one group out. But I need to say this. One of the foundations of medicine, nursing, and the things that we provide on a daily basis is observation. In 1796, a country physician found out that milkmaids who were exposed to cowpox did not get smallpox. Observation. 213 years later, a nurse manager at Eastern State said, from 2 o'clock till 5 o'clock, we're having a large amount of restrictive interventions. What if we did something as simple, as intuitive, but as important and necessary as providing a snack? And what that group, Kevin Bryant, who I think is fishing this week, Mary Whitman, Nikita Hayes, Sarah Kolstead, what that group found was a 98% reduction in restrictive interventions. Based on observation, they had that impressive a result. So the 2019 Rapid Award goes to Kevin Bryant, May Whitman, Nikita Hayes, and Sarah Kolstead for their work in hunger and agitation in the behavioral health setting. Please stand up. Please come up and receive that award.
Thank you.
All right.
Thank you.